Restorative scans. When the patient has integrated implants and temporary dentures on both arches. First, we need to perform foundation scans. When scanning a denture, we must ensure a stable bite. To do this correctly, we first scan the facial and occlusal of one denture extraorally in the first scanning window. Do not scan any of the tissue side yet. This is to provide the scanner with a reference to form the bite scan. We will return to complete the rest of this scan shortly. Continue to scan half of the lower denture in the next scanning window. Using the same strategy, scan the facial and occlusal surfaces of the denture only. Once the facial and occlusal surfaces of each denture are scanned, it is time to add impression material. This is to stabilize the bite and form a wash impression. Don't add too much material, or it will distort the vertical dimension recording. Do the same for the lower denture. Now, carefully place the dentures in the patient's mouth. Ensure they are correctly seated, and have the patient form the correct bite. Any movement will result in inaccurate scan data. Some scanners require a single scan across the entire facial surface. Others require 2 separate scans. It is advised that even for scanners requiring left and right scans, to scan up to the midline, not just the occlusal contacts. Once the bite scan is complete, carefully remove the dentures. Ensure the wash impression is set. Return to the original scanning window in your iOS software and continue to scan the denture. Begin on the facial or occlusal surface to provide the scanner with a recognizable feature, and then continue to the tissue side to perform a detailed scan of the impression to form a 360-degree scan. Perform the same 360-degree scan of the lower denture. Return to the lower scanning window and begin scanning on the facial or occlusal surface to provide the scanner with a reference point. Continue to the tissue side to perform a detailed scan of the wash impression. These scans will eliminate the need for separate tissue scans. With both dentures now scanned 360 degrees and the bite scan complete, the standard scan gauge scans can be performed. To accurately capture implant data, the scan gauges must be arranged correctly. Gauges must be in close proximity to each other without touching. They must be completely seated and, importantly, always use retractors to avoid interference. Use any combination of gauges necessary to bridge the gaps or relieve tissue pressure. If 2 multi-units are too close together for 2 scan gauges to fit, replace one with a narrow scan body. Turn off any AI or scan assist feature on your intraoral scanner. Once checked, begin the left to right scan. Start at the most distal implant on one side, rocking the scanner head over the top of the gauges and moving across the arch in one continuous motion. Do not go back over previously scanned areas. If errors or artifacts appear, delete the scan and start again. Once complete, save and open the next scanning window. Repeat the scan from right to left. Tilt the scanner as necessary to capture all facets. Before removing scan gauges, export both scans as STL or PLY files and check in the Nexus analyzer. Continue to the lower arch. Place gauges by following the arrangement rules. Lower arches are made difficult by greater interference of the tongue, lips, and cheek. Use retractors like umbrella to have a clean scanning area. Once checked, begin the left to right scan. Start at the most distal implant on one side, rocking the scanner head over the top of the gauges and moving across the arch in one continuous motion. Repeat the scan from the opposite side in a new scanning window. Capture all facets and ensure nothing interrupts the scan. Export scans immediately and check accuracy in the Analyzer tool. The dual arch restorative protocol using dentures requires a total of 7 scans, as well as the standard 2 patient photos. Following the correct procedure of scanning the dentures and capturing the impression data is important. For more information, see the Clinical Resources section on the Nexus Connect Lab website.